The current status of nursing model research for patients with mental disorders. Literature learners based on table of contents, background, research methods and results, Gaussian model classification, challenges and difficulties, outlook and suggestions, summary, background. With acceleration of the population, aging processes in our country, the prevalence of mental disorders has been on the rise, and the needs of people with severe mental disorders for old age care have become increasingly prominent. Elderly patients with mental disorders have non-treatment period, heavy burden of family care, and no degree of social integration, which cause greater influence and burden on their lives and families. However, there are still shortcomings in the existing patient systems. The elderly care service for patients with mental disorders has gradually become one of the hard issues concerned by the public. The elderly care of patients with mental disorders is an important issue that can't be ignored. Traditional old age care models may not be able to meet their specific medical and nursing needs. Based on the analysis of the relevant literature in NK, the current research progress on patient model for patients with mental disorders in China was grasped, and the future development trend was forecasted. Research methods search by subject to mental disorders, elderly care, from August 11, 1970 to November 19, 2022, a total of 135 articles were published on NK. The total literature includes 89 Chinese and 46 foreign languages, including 80 academic journals, 39 theses, 1 conference, 3 newspapers, and 1 achievement. Research and analysis were carried out according to the classification of subject word, subject, publication year, research level, documental type, documental source, author, institution, and fund. Research results include subject word, subject, publication year, research level, documental type, documental source, author, institution, fund. For example, subject term, disability patient, elderly care institution, mentally disturbing, 8, mental disorder, 7. Psychiatric disorders, 7. 5. Better. Subject classification. Chinese politics and international politics. 44, 41. Church. 35. Clinical medicine. 80. Administration and state administration. 50. Medical and healthy policy and norms and regulations resource. 30. Sociology and statistics. 10. Better. Publication year 2022, 12, 2021, 2022, 2020, 13, 2019, 13, 2018, 8. Better. 2006, 2. Chinese literature began to appear in 2006. Research level. Developmental research. Policy research. 11. Applied research. 10. Engineering research. 4. Engineering and project management. 3. Technical research. 3. 8. Documental type classification. Message 2. Research paper 41. Documental resource. Social welfare. 8. The European Journal of Public Health. 7. Chinese Civil Affairs. 4. Scandinavian Journal of Public Health. 4. Jining University. 3. 8. Institution. Department of Social Welfare and Social Affairs. Ministry of Civil Affairs. 4. Jining University. 3. Southwestern University of Public Sources and Law. 3. Zhejiang University. 2. 太原 Psychiatric Hospital. 2. 8. Also classification. Chinese author 20. Foreign author 20. Bundle classification. National Social Security Foundation. 2. Zhejiang Medicine and Health Science and Technology Project. 1. Shanxi Prison Science and Technology Project. 1. Humanities and Social Sciences Research Project of Ministry of Education. 1. Research results. Year of publication. Center first foreign literature study in 1970. There is only one foreign literature study per year. By 2006, Chinese literature began to exist, and by 2010, it began to gradually increase. Research realms mainly focus on mental disorders, patient institutions, and the combination of medical care, government decision making. Subject classification. The top subjects are Chinese and international politics, psychiatry and clinical medicine, and social and administrative management. Research level. Mainly developmental research, policy research, application research. Type of research documents. There are two types: research papers and information. Many research papers. Intellectual resources. Many social welfare, Chinese civil affairs, and some foreign and domestic university magazines. Authors. There are domestic and foreign authors. Most of the domestic authors published 1 to 2 articles each, and one author published 4 articles. There are basically 2 to 4 foreign authors, and one author has 7. Categorize all ages. The Ministry of Civil Affairs and the Department of Social Welfare and Social Affairs are at the top of the list. Founder classification. 5 are founder hierarchies. It shows that the state and the local governments also support research in this area. But the support in this area is relatively small. Review of research results. After analyzing hundreds of relevant papers on relational knowledge network, the following conclusions are true. Diversified patient mental taxation. The distribution of resources is unbalanced. Lack of professions. First of all, the mental health problems of the elderly in China have been relatively serious, and there are significant class differences in the mental health of the elderly. The mental health level of the elderly with agricultural household registration, no income and no education level is lower. Second, there is a significant positive correlation between cumulative old age care and the mental health level of the elderly. The positive effect of cumulative old age care on mental health is heterogeneous among different groups and people with agricultural household rich situation and no income benefit more. Common patient model. Family support institution patient community home care professional nursing institutions for mental disorders. The results show that research object selection, family patient 23%, organization 12%, community home care 19%, nursing institution for patients with mental disorders 46%. Persons the families hope that the patients will be admitted to professional nursing institutions for mental disorders. 19.3% needed nursing care, nursing care within 5 years. Other patients with severe mental disorders and their families expect more social protection and receive social services. Challenges and difficulties. Addressing the patient system of mental health services is inadequate. Unequal distribution of resources, professional shortage, the social acceptance of patients is low. Each model has its advantages and limitations. While traditional family care is culturally advantageous, it is often inadequate in the face of increased disadvantage. Professional institutes can provide more professional medical services, but there are problems such as hierarchies and a shortage of beds. outlook and suggestion. Policymakers expect it is necessary to strong multi-department strengthen sharing among regions, train more professions, and improve the services level. On the issue of old age care, the government should actively play a leading role and highlight the public welfare of elderly care services and actively explore a set of adjunct services. Elderly supply with Chinese characteristics of the elderly services system to achieve the combination of medical care in order to better meet the needs of elderly people with mental disorders. Summarize. Based on the above data analysis, the relevant literature of NK reflects that the current patient model of patients with mental disorders in China is facing many challenges. Although the existing patient model for patients with mental disorders has achieved some results, there are still many areas that need to improve it and perfected. Governments, social organizations, and individuals need to work together to solve this problem. Follow-up research should pay more attention to better collection and case analysis at the practical level, and pay more attention to how to achieve the effective integration of various resources and the overall improvement of service quality. In particular, it is necessary to increase the support for this aspect from the policy level, such as increasing capital investment, strengthening personal training and resource system instruction. Provide meet the needs of growing number of people with mental disorders. Thank you.